So I thought it would be cool and helpful for everyone if I start a little series with my little tips and tricks that I give my patients. This series is going to be about urinary incontinence and urinary frequency and urgency. This is video for tip number 1. If you want to, go ahead and follow along if you want to hear more tips, okay? So tip number 1. What are urinary habits that are considered normal? So normal is every 2 to 4 hours, 4 to 6 times a day, 0 to 1 times at night, and not every night, and up to 2 times a night if you are a senior. Okay, so I usually tell my patients that if they find themselves going to the bathroom less than every 2 to 4 hours, you always want to ignore your first urge. Okay, so let's say you go to the bathroom at 10 a.m. If you get an urge before 12, that 2-hour mark, you want to ignore it. All right, you're only ignoring the first urge, not the second. So if the second urge comes 10 minutes after, even though it hasn't been 2 hours, that's totally fine. Eventually what's going to happen is your urges are going to be fewer and far between. I don't want you to force yourself to hold it for every 2 hours, because that's not good either. Just ignore that first urge. Some things that you could do: you can just ignore it. You could do quick kegels, so squeeze, 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 squeeze. That should take care of it. You also don't want to go to the bathroom just in case. That builds really bad urinary habits, and it definitely can contribute to you having overactive bladder in old age. So if you have any questions, leave them in the comments.